Insights from the world's best medical minds. You are watching TheRightDoctors.com.
Good afternoon, friends. This is Dr. Suresh Sankhla from Mumbai. I am a consultant neurosurgeon, the chief neurosurgeon and head Department of Neurosurgery at the Global Hospital Parel in Mumbai. I welcome you all to this platform, a medical platform, the TheRightDoctors.com, which is India's leading medical knowledge platform. I welcome all you on this platform. I'm going to talk about the neurosurgery in pandemic times, which is what we are all going through and experiencing. COVID pandemic has really changed everybody's life, and the total view how to really deal with the neurosurgery patient is no different than any other medical subject and medical facility. Because of the lockdown periods and the restriction imposed during the lockdown period, there has been a serious confusion, state of anxiety, fear, and panicky state amongst not only doctors but the general public, and particularly the patients who are suffering from various illnesses, about how to go about the treatment part, whether to go to the hospital or not to go to hospital, whom to contact, and how we take forward the medical treatment. So before I go to the COVID part or the pandemic part, I would just try and tell you first how the neurosurgery or what really belongs to neurosurgery. What are the patients who really fall into neurosurgery group? So the neurosurgery, number one and the maximum number of patients in neurosurgery are because of accident. You must have heard lots of roadside accidents, head injuries at home, at workplace, and in the sports field, and all sorts of life in our day-to-day life that we encounter some sort of accident, whether minor, serious, major, or very, very life-threatening because of the accident, because of the trauma to the head, brain, and spine. So that makes the majority, the main bulk of neurosurgery patients. And as you must have seen, that varies from a simple scratch or simple crack in the skull or simple bleeding from the head or nose or ears to a condition which can lead to loss of consciousness, loss of vision, loss of speech, paralysis, and a persistent vegetative life. So this is a very serious disease, and it should be looked after very, very carefully. What is important is that these patients should be immediately shifted to a medical attention where the neurosurgeon can look at these patients and perform whatever is required, the investigations, the treatment as soon as possible, because we know the part of the spinal cord or the brain which sustains injury is the area which can recover if proper medical attention is given on time. In addition to that, there is the surrounding part of the brain which has not suffered injury directly, but it is going through some sort of damage because of the injury in next few hours time. So we have a window of an hour or hour and a half, which is called as the golden hour, which means that this is the time we should act fast and start treatment, start investigation, and stabilize the patient in order to prevent injury to the normal brain, which is suffering lack of oxygen or lack of blood supply because of the head injury. So this golden hour in the head injury part is very important, and most of our staff and the head injury team is instructed to start working right from the site of the injury on the roadside or at the home or at the workplace where the injury has taken place. The treatment begins there and then it continues till the patient reaches the hospital in the casualty area or in the ICU, and the same treatment continues afterwards. If you ignore that part, or if you neglect that initial hour or hour and a half hours time, and just do not take care of that patient or stabilize this patient during that time, that patient may not recover completely and will end up with very serious consequences, which are going to last for all his life. So, head injury or brain trauma, spinal trauma is number one neurosurgical emergencies, and it should be treated like that. The second sort of emergency, which is neurological emergency, is the brain stroke. Brain strokes and brain hemorrhages. These are also very, very serious conditions, and the mechanism remains the same. The brain gets damaged at the onset of the illness. That means whenever there is a blood clot in the circulation stops. A certain part of the brain doesn't get blood supply, doesn't get oxygen, doesn't get nutrition, and because of that, the damage starts. So that is one part. But subsequently, what happens is even more dangerous. The surrounding brain, the area of the brain which are close to that injured part of the brain, if those parts of the brain are not really prevented from injury or any kind of insult, then those areas of the brain also go into some irreversible damages from where the recovery is impossible. And that is why in strokes also, it is very important to treat the patient or stabilize the patient as soon as possible. And now we have got very acute management policies, strategies available, and if you go according to that, you can reverse those neurological deficits completely. Similarly, the blood clots, the brain hemorrhages, equally bad emergencies, can damage the brain and part of the brain, which leads to damage to the surrounding brain, and the next part of the brain, at one after the other, the brain parts get damaged, and then the recovery is impossible from them. So right from the beginning, either we have to do the operation and remove the clot, or institute some medical or endovascular procedures in order to remove the clot and stabilize the patient as soon as possible. So these two emergencies, the head injury, the brain injury, or the brain strokes, they makes the majority of the neurosurgical emergencies, and which can be treated as soon as possible. Then comes the next thing, which is brain tumors or spinal cord tumors. The tumors arise within the brain and spinal cord as a small nodule or a small part, and then it continues to grow. Now, the rate of growth depends on the type of the tumor, whether it's a malignant tumor, whether it's a benign tumor, but every tumor grows, or most of the tumors grows. So the symptoms in the beginning are very, very minimal and can be noticed. Sometimes person cannot notice those minor symptoms. Subsequently, those symptoms continue to increase. As the tumor is increasing, a tumor is growing inside the brain on the spinal cord, and then lead to loss of memory, paralysis, balance problem, speech problem, vision, loss of smell, loss of sensations, and difficulty in walking, and all these symptoms continue to grow. So, this is an emergency, but this is not as acute emergency as we had in the brain trauma and brain strokes. The brain tumors, if they are rapidly growing, they require a relatively earlier medical attention. Brain tumors, which are very slowly growing, they require a proper planning and the surgical intervention at a proper time. Most of the brain tumors start with headaches or giddiness, and these symptoms, if they do not respond to the regular treatment, then eventually they continue to grow, and that means there is something wrong, and those patients should be investigated properly and looked at with the other angle. And with investigation, you normally detect the brain tumors. And once the brain tumor has been detected, depending on what type of the tumor and the rapidity with which the tumor is manifested, the treatment should be subjected to. So the brain tumors form the majority of the brain and spinal cord ailments, and a lot of people suffer from brain tumors at a different stage. Small children, even the newborns, can have different types of tumor. The children in their teens, they have different types of tumor, and then the tumors of adulthood are different. The tumors in the elder age group are also different, and all these tumors should be looked at with the same suspicious and should be treated with the same management policy. Uh, then the tumor, then the brain tumor or the brain problems are coming, which manifest with a very slow growing manifestation or the slow developing clinical signs and symptoms. These are usually degenerative variety, and they come in later part of the adulthood, and most of the time because of the degenerative nature of the diseases. Sometimes they present with backache or headache or impairment of the memory or impairment in the vision, but then they are very slow growing and can be easily picked up at some point of the life. Majority of the adulthood or the old age symptoms are related to walking, or the pain in the back, or pain in the neck, or pain in the arms, or tingling numbness. And all. These are all degenerative uh, lesions or degenerative illnesses which should be investigated properly and should be treated properly. They form a majority, a bulk of the neurological illnesses. And if you sit in the neurosurgery or neurology clinic, you'll find most of the patients belong to this category. Also, epilepsy is a very, very common symptom, and the presentation you will see can occur in any age group, but the cause, the etiology is different. In children, it is because of something happening inside the brain, because of the tumors or hemorrhage or something. The epilepsy presents. The epilepsy is also without any etiology. It can present as a symptom of some etiological, some disturbances inside the brain at the time of the birth or soon after the birth. So that epilepsy is different than epilepsy in the adulthood. In the adulthood, with a normal childhood and then suddenly epilepsy comes up, that means there is something growing in the later half, and that should be investigated and treated. Cerebellar ataxia is another symptom of something growing inside the brain, usually coming at the adulthood or later in the life. Person loses the balance not only in the legs and walking difficulties, also in the upper limbs, also in the trunk. He can't sit and have uh, 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 disturbance in his balance. Uh, then there is a movement disorder. There are a lot of movement disorders nowadays identified, and these can also appear in the latter half. One of the most common movement disorder is the Parkinson's disease, which we are all aware of, and we know that the Parkinson is now commonly, as the medical knowledge is increasing, the treatment options are also increasing. So many of these degenerative disorders are now recognized very well, and because of our increasing knowledge about these medical illnesses, the treatments have also improved, and now we have come to a stage where we can control many of these illnesses initially at the onset or soon after the onset, and even the later part of the illnesses. Friends, we are going through a very tough time of this COVID pandemic, and there are several of these neurological diseases which have really taken backseat because the patients sitting at home are not aware whom to contact, how to go about identifying these illnesses, how to go take medical attention, take the medical treatment, get the investigations done, and go to the hospitals, get admitted. There is utter confusion going on because of this COVID pandemic. The COVID patients are are very at higher surgical risk. If you diagnose a tumor and you advise any surgical treatment of that patient, because of the presence of the COVID, there are several uh, limitations which we should understand. So once the patient comes with the COVID symptoms and the COVID positive, and then diagnosed as a brain tumor and all that, you do not institute the same treatment as you do on a normal patient, because the COVID itself has got its own disadvantages and its own morbidity and mortality and all that. So how to deal with them, we go later on. But let me tell you about that the non-COVID patients. Non-COVID patients are also patients from the general public and general population having all those ailments which we have discussed so far, including brain tumors, brain hemorrhage, and all these degenerative diseases, strokes. Stroke is very commonly affecting these patients. And all these things are really happening, and we see day to day these patients coming to the hospital casualties and uh, getting admitted and seeking medical uh, attention. So, non-COVID patient, the COVID infection risk is high, and they should be really dealt with very carefully in these patients, in these atmosphere where there is so rapid COVID pandemic is going on. The availability of bed is also a big problem, because most of the hospitals are really now full with the COVID patients, which takes priority because of their illnesses. And most of these neurological patients which require medical admission, hospital admission and medical attention, cannot be treated in the same way as we used to see the patients uh, previously. There is inadequate hospital staff to deal with these patients. In addition to the COVID patients, there is inadequate specialist doctors and technicians available in the hospital to deal with these patients. And the regular clinics are now closed. In most of the hospitals and the periphery, the doctors and the medical specialists are more focused or concentrated towards the COVID patient care, and therefore the specialists who are supposed to look after the neurological patients are much less in the hospital and in the outside the hospitals. The regular clinics are closed. The transport facilities are also much less. So bringing the patient from home to the hospital is also a major problem. And within the hospital, there are so many restrictions as far as where to keep the COVID patients and where to keep the normal patients. Most of the hospitals who are running both the facilities, it is very difficult to really find a safe place for the non-COVID patients who has neurological problems. So in most of the hospitals now, we are dealing with the emergency, neurological emergencies admissions. And most of the hospitals have a separate ICU and a separate casualty to take care of the neurological emergencies. Uh, as we have seen and we discussed, the accidents or the head injury, head trauma used to be the main or main bulk of the neurological emergencies. Surprisingly, now the accident cases are much less. But the other medical emergencies like brain hemorrhages, strokes are more common, and their frequency and their incidence is more or less the same. And every day we see the hospital casualty or the emergency department receiving so many patients coming for the treatment of stroke and hemorrhage, which you cannot uh, ignore and cannot neglect. So, taking care of these COVID patients, we also have to take care of the patients who suffer stroke, brain hemorrhages, and some of the patients of head trauma, although much less, but then these patients also keep coming, and we have to take care of in the same way as we used to do earlier. Another bulk of patients who used to come earlier with brain tumors in all the age groups is become less because of the COVID pandemic. But then, if you see, go to the any casualty department, you will find that these patients also slowly rising, and the patients are coming with the diagnosis of brain tumors, and they require emergency treatment. If not at the same emergency as the stroke patients do require, but yes, these patients also require emergency treatment and emergency admissions. Most of the hospitals are now divided into complete sections of COVID and the non-COVID sections. So in non-COVID sections, we can admit these patients and we can take care of these patients with the same care. So the emergency services are usually running in each and every hospitals, and we admit all these patients through the hospital emergency services into the ICUs. As I told you earlier, the priority is the stroke patients, because the number of stroke patients has not decreased. The number of brain hemorrhages has not decreased. It is coming in the same way, and you have to keep the same protocols and the same criteria to deal and to take care of these patients. And the number one criteria is that these patients should be considered as a top priority. As I said earlier, there is a very limited time to take care of these patients initially. And once the initial treatment has been substituted, the subsequent treatment continues in the hospital or at home or at nursing homes. But the golden hour, soon after the head injury or soon after the stroke, is the most important thing, and every clinician should really follow the golden hour rule very, very efficiently. So how we should do it in the casualty department? As soon as the patient comes, we do the nasal swab and throat swab for the PCR, and also do the chest CT scan to rule out any pneumonia in these patients. This is the basic investigations, and it can be done in each and every small center, every hospital, to basically identify which patient we should be considered as a COVID patient, and which patient should be taken as a non-COVID patient. Although it is not the full system, but at least you can differentiate it and you can isolate them uh, in the in the casualty department itself. Once the patient has been identified of the stroke, irrespective of his status, the treatment should be substituted immediately, and in the same protocol and in the same way as we use in the other patients and the pre-COVID era. The non-emergency services, the things are very clear. We do the video consultation, and which is a very, very common practice now. And with the video consultation, you can identify those patients who are urgent admissions and those patients who can be treated at home with multiple consultations on video. Those patients who do not get a very clear picture or who do not get respond to the initial treatment should be then called to the hospital OPD in the clinic for consultation and the preliminary examination, and to identify what exactly is the problem. So the limited number of patients can be called to the hospital OPD department, outpatient department, and should be examined with proper care. Uh, the number of appointment should be limited. These are only selected patients from the video consultations who have problems which have not been sorted out at home, which have not been sorted out by the video consultations, and require personal examination or the personal consultation in person. So that's why these patients are later on called to the hospital OPD department and are examined by a neurosurgeon or a neurologist for various clinical signs and symptoms. At the same time, if any investigation is required, like a CT scan, brain scan, or MRI scan, or any blood test, it can be done immediately while the patient is still in the hospital, and the seriousness of the disease is identified. If the disease is very serious, patient should be immediately admitted. If the problems are controllable at home, then we can send the patient after the initial consultation home, and then the video consultation is continued subsequently, and the treatment is supervised. While the patient is in the OPD, we take the proper precautions of number one, limited number of patients appointment, no crowding in the OPD or in your office area. The room should be as open as possible. All the closed room should be avoided. All the partitions should be done. Usually a transparent partition should be followed, and it should be used so that there has to be some kind of isolation of the patient away from this. And the usual methods of precautions like face mask, face shield, gloves, etc. should be used as much as possible in order to keep a proper isolation of the patient from the medical staff. Now, lately, we have also started the planned surgery, thinking about the planned surgery of the non-COVID patients. Those COVID patients who have symptoms and signs are slowly progressing and they are not getting benefited by the treatment at home. We call them to the hospital and we do the COVID test. And when the COVID test is negative and they are completely non-COVID patients, we can admit those patients and do the essential test on him and do the essential minimal surgical procedure which is required for those patients, which require a short hospital stay and minimum consultations from various other specialties. Those patients should be admitted and treated. If required, a surgical procedure should be done. And as soon as the patient is stable clinically, should be sent home, and the subsequent consultation should be continued on video from home. More frequent, maybe weekly or even twice weekly consultations on video with the patient and the patient's family members to see to see the progress of the patient, how the patient is progresses, if there is any medical treatment changes required that can be done immediately. But those patients should be supervised very, very carefully from home. Similarly, the other treatment modalities like physiotherapy, like rehabilitation, and blood testing, and all these facilities should be made available at home as soon as possible so that the patient doesn't have to come to make the hospital visits very, very often. And this is now possible at our hospital and many hospitals in the city of Mumbai and other places. This kind of facility has been started and it's working very well. The patients are supervised on a very regular basis on the video calls, and their progress is observed, progress is monitored. Medical treatment changes are made from time to time and are monitored from the doctor's office in the hospital and the patient being at home. So all those patients who are first assured, there's no need to worry because of this pandemic. There is no need to worry about any of the medical negligencies or in the medical insufficiency, inadequacies. Everything is available, and all the patients are completely made aware of the medical facilities available in the city of Mumbai, in our hospitals. Medical practitioners stay in touch with the patients from time to time, and reassurance is done to the patient as well as to the family members that yes, every medical facility will be available. If necessary, patient can be called into the hospital again and assured that everything is fine, all the tests are possible, and everything can be done. Now we have now with all these protocols, we have come to a point where we can really provide this service to various category of the patient depending on the seriousness of their signs and symptoms. So for the minor symptoms like small headaches and giddiness, immediate video consultation is made. The specialists look at those patients, the neurologists or neurosurgeons, talk to the patients and the family members on video and make sure that the symptoms are not rapidly progressing, the symptoms are not serious enough, or there are some signs which are missed by the patient and the family member can be picked up immediately on the videos. Various kind of strokes, minor strokes or major strokes, can be differentiated on the videos very well. And if the signs and symptoms of the illness are not very serious, the patient can be treated very well at home without even exposing them to the outside world. And the patient can be reassured, patient's family member can be reassured, and the treatment can be started without any problem. Those patients can also monitor from time to time from the doctor's office in the hospital, while patient without moving the patient outside the comforts of their home, and their progress is monitored. Whenever it is felt that the patient is not progressing or the symptoms are patients are not recovering or the symptoms are progressing, the consultants, neurologists or neurosurgeons can have more frequent video consultations with this patient, and appropriate tests or investigations can be ordered, can be discussed on the video consultations, and then based on that, the treatment can be advised and monitored while the patient is still at home. However, if the patients are progressively increasing and it is felt that the patient should visit the hospital, special arrangements are made for the patient to visit the hospital, clinics, and have a complete examination by the neurologist or neurosurgeons in the OPDs. Now, these OPDs are specially arranged OPDs where the patient and the doctor contact is made in such a way that there's always a partition, there's always a good communication between the patient and the, but at the same time there is no clear contact between these two. So at our hospital we run the clinics with the partition, and we talk to the patients very clearly, we look at all the examination findings, we see all the patients very carefully, and we see all the investigations, we go through every test and, which has been done in the past, the patients, and come to some diagnosis. And then if we feel that this patient can be treated at home, we send the patient back at home and then continue video consultation. Or if we feel that the patient may not be advisable to be treated at home, that patient can be advised to get admitted in the hospital in a ward which is away from the COVID and on the infection part of the hospital. So every hospital has sections which are clearly divided, and non-COVID patients are kept in the non-COVID section of the hospital, which are clearly away. The doctors' teams are different, the nursing teams are different, the technicians are different, and all the hospitals for staff is different who are taking care of these non-COVID patients. While they are in the hospital, the relevant investigations are done comfortably, a CT scan or MRI scan, and any of the tests which were previously conclusive or required to be repeated is repeated. And if the results are very comfortable, and if the patient becomes comfortable in a day or two, the patient can be sent back home, and rest of the treatment is again continued on the video consultation from home with the same specialist. However, if the symptoms are severe and the rapidly progressing signs are developing while the patient in the hospital, the patient should be immediately admitted in the hospital or in the ICU. Relevant investigations are done, and the treatment is immediately started. Uh, the progress of that patient is followed by a team of consultants, and if required that this patient has a brain tumor or brain hemorrhage or stroke or any kind of acute illness, it should be immediately taken care of by the team of the specialists. Once the patient is stable, the home care the patient is sent back home, and the home care services, which include the nursing care, the investigations, the physiotherapies, the rehabilitation part, everything can be arranged at home, and that patient is then, from that point onwards, is treated at home by the same team which was treating in the hospital. The patient who required surgery immediately taken for the surgery, and as soon as they are stable, they are shifted to the non-ICU section of the hospital, and from there the rehabilitation or the physiotherapy started. And as soon as they are more comfortable and more stable clinically, they are sent home with the advice to continue similar type of treatment at home. And those patients are followed from time to time by a team of the doctors on video consultation in the hospital, while patient is still at home. If necessary, those patients are called in again for various investigations and consultation by the doctors, and the treatment changes which are made, and the patient's progress is monitored, and the patients are sent back. So primarily those patients are treated in the hospital. As soon as they are found more stable, they are sent home, and the rest of the treatment is continued at home by the home facilities and the patient's family members. So right now, the advice from the medical team to most of these patients is to stay home. Most of the time, those patients should really spend a good quality of time at home with the family members, and the family members are trained and educated so that they can take care of these patients at home in the familiar environment, them comfortable, and remain with the family members. Most of the normal population, or the most of the patients, are advised to stay home and spend time with the family members, do the regular activities as they are advised from home. Even work should be done from home as much as possible. There is no need for everyone to go to the workplace to do the work. Work from home is the new strategy that we have to follow and continue. Even for the patients, they do maximum physiotherapy and maximum treatment from home rather than going to the medical institutions for small things. Also, disciplined lifestyle is very important, and that we should really follow now. Every one of us should learn how to have a disciplined life at home, how we should take care of ourselves at home, how to do the physical exercise on a regular basis, day to day basis at home. What are the activities which should be continued at home, and which should be really maintained on a day to day basis at home, and at what point they should take the medical advice, at what point they should go to the hospital and get themselves investigated. So physical exercise is a very important part of our life now. It used to be a very important part anyway, but now it has become a part of our day-to-day activity, and we must follow it very, very carefully and very religiously. Nutrition values are also important. They were important all the time, but now it is much more important, because you have to take care of yourself. You should really have more nutritious food and more nutritious diet, and take care of yourself. You should not really end up with various comorbidities of sitting at home, like obesity, hypertension, and ischemic heart diseases, diabetes, and all these things. So you should indulge yourself in regular exercise. It should become a part of your life now, how you should really take care of yourself and your family members. The two groups in the family are very important. One is the younger age group. They do not know what is happening with them. So you have to really make a very disciplined life of not only yourself, but to the younger individuals in the family, and also the elderly age group. The elderly age group, they are incapable themselves by doing many of these exercises, many of these activities. It is where they need your help, they need the family members' help. They are already suffering from many of the diseases like diabetes, hypertension. All these things should be taken care of at home, and the medical advice is available every time, anytime, whenever you want. But most of these activities should be taken care of at home with the help of the medical advice. You should really change your hobbies in such a way that you spend more time in reading, writing, painting, exercises, physical activities, gardening, and various of your hobbies should be continued at home to keep yourself fit and healthy, as well as keep your children, your younger individuals in the family, as well as the elderly members of the family very fit and disease free. Take care of the children and elderly is the most important thing. The medical advice is available anytime, and it is our job to really make sure that the medical advice is just available a phone call away or one email away, and we can provide most of these medical advices on personal communication as well as communication while the various departments in the hospital and to take care of these patients and prevent yourself from various morbidities of this kind of life. The online education is now available, and it is more freely available now than before, and it should be utilized. It should be utilized by everybody. Various seminar education programs are available online, and one should take care of these things. Even the medical practitioners, like ourselves, we also take part in the patient's care in the hospitals, patient's care at home, as well as we keep ourselves busy with various seminars and medical conferences, webinars to keep the knowledge updated, to keep our experience in the treatment of these patients updated from time to time. It is also helps educating various patients and general population at large. When you have to go out, you have to follow safety measures. There is no doubt about it, and there is no restriction on this thing and no freedom on this thing. Whatever is mentioned and provided by the government authorities and the medical practitioners, you have to follow it. You have to take care of. You should not become burden on your society. So you should take care of yourself. You should take care of your elderly family members and neighbors, and unnecessarily going out and making crowds at various places is not a good idea. You should really make sure that everybody remains within the safety limit of health and education. So you should not only follow all those instructions, you should also make sure that the others are also following, and you are educating time to those people who are unaware of these restrictions. We have a long way to go with this pandemic, and we have very limited experience at this moment. We don't know what is going to happen in next 6 months' time. But whatever the knowledge we have, whatever the experience we have to really share it with other patients, share it with the general population, share it with everybody else from children to elderly, and make sure that general population, the public does not really fall sick because of lack of knowledge. So what are the most important safety measures are face masks, the social distancing, hand washing, avoid unnecessary gatherings, avoid unnecessary traveling, avoid unnecessary crowding at any place. Keep safe distancing with the neighbors, safe distancing within your residence area, safe distancing in the shopping area where you have to go to do the shopping, and follow all those limitations, all those instructions strictly, and make sure that nobody really falls sick because of lack of knowledge. Help each other more than before is very very important. Help elderly, help children, help those who are unaware of all these problems. With this, I end my talk here, and I thank you all for listening to me. And I am available at any time at Global Hospital for discussions, for more educations, for conversations, for giving instructions, helping our patients of stroke, helping our patients of brain tumors, helping our patients who are managing themselves at home, or the managing the family members who are sick, having a stroke or something at home. We can advise them at any point. If they contact the hospitals, the consultants are free. The neurosurgeons, neurologists will be happy to really help you out, giving advice and giving instructions how to deal with this problem until we come out safely from the COVID part. So I thank everybody who are involved with the rightdoctors.com and everybody who is involved with the entire process of education, and wish you a healthy life and have a good day. Thank you very much.
Insights from the world's best medical minds. You are watching TheRightDoctors.com.